A methodical and thorough trauma assessment begins with the scene survey. When you arrive at a scene, assess the conditions for safety. Look for threats to your personal safety. Hazardous materials, changing weather, and passing traffic are just a few examples of factors that add risk to the scene. Ensure your safety first before you begin any assessment or treatment of a patient.
One, you want to maintain provider safety. So that's also a part of the primary survey. It's not necessarily touching that patient, but I have to make sure I'm not going to become a patient myself. And if I need any additional resources, or I find that that person has life-threatening injuries, I need to make sure I have a way to get them to the hospital. So those are some things that I'm going to go ahead and look at as I'm rolling up to the scene and getting ready to do that primary assessment.
After your safety is ensured, assess the number of patients and determine the need for additional resources. If the scene is a mass casualty incident, perform triage to prioritize patients according to protocol. The first step is to form a general impression of the patient from a distance. You can use the acronym SWAP to create a quick general impression of the patient's sex, weight, age, activity, and position. Consider the mechanism of injury and determine if C-spine precautions are necessary. Identify the patient's level of consciousness by checking whether the patient is alert, responds to voice, responds to pain, or is unresponsive.
Once I get there and I see the patient, I'm going to determine my mentation. I'm going to determine level of responsiveness. Do they respond when I speak loudly? Do I have to do something painful, such as a sternal rub, to get them to respond, or do they not respond at all?
All patients require an airway, breathing, and circulation. If you identify any issues within these three areas, correct them immediately.